I'm Adam Powell. I'm one of the pediatric cardiologists here at Cincinnati Children's. And chest pain is actually quite common in kids and young adults. But thankfully, the heart causes, the scary, life-threatening heart causes of chest pain are very rare. And when there is something wrong with the heart, there are normally warning signs or red flags. And that's either in the story that the child or the young adult tells us, in the exam when we listen to them, or the family history, as the scary, life-threatening heart causes of chest pain tend to be highly genetic and run in families very strongly. The muscle causes of chest pain typically has a story of maybe some cramping pain, sometimes sharp pain, but it's pain that's normally made worse with certain maneuvers. Those things can be taking a deep breath in, actually touching the chest can sometimes make the pain worse, and occasionally different position changes, laying flat, turning, movement. All of those things are common in kids with muscle-type cause of chest pain. The other hallmark of muscle-type chest pain is that it's normally pain that happens at rest, not pain with activity. Chest pain because of muscle causes in children can actually be quite painful, and sometimes beyond being painful, it's scary. Anytime your child is saying that they have a pain in their chest, and it can cause a lot of anxiety and a lot of stress for both the child and the parent. But thankfully, even though it can be quite painful, it doesn't necessarily mean that it's life-threatening or it's going to hurt or kill the child. So a child, especially a young child, can interpret a lot of things to be pain in the chest. For instance, indigestion, an irregular heartbeat, difficulty breathing. Sometimes, especially a young child, will say their chest hurts. And so when young children complain of chest pain, it doesn't always mean there's a heart cause of chest pain. And that's one of those things when we discuss causes of chest pain with your child and your pediatrician and the parent, we always try to get a little bit more history on where is this chest pain located, what is the child doing when they have chest pain, and what are they doing to make the chest pain better or worse. Chest pain can really happen at most any ages. In young children, particularly young toddler age or young school age children, they can have chest pain both from muscle causes as well as other causes like growing pains. As children get older and start participating in sports and being more active, they can have other causes of muscle type pains. They can have muscle sprains, muscle strains, trauma-related pains, particularly with contact sports, as well as some of the traditional type growing pains that can happen during the periods of rapid growth in adolescence. If your child does complain of chest pain, there are some kind of higher risk, more concerning features that a child could tell you. For instance, if your child's having chest pain with exercise as opposed to rest, chest pain with exercise can be more concerning. If they're having chest pain that isn't better or worse with anything they do, meaning the chest pain isn't better with big breaths, with movement, with touching it, with food, with water, or if they just have really, really severe chest pain so bad they can't do anything. Those are all more concerning features, and those would be things to discuss with your child's pediatrician. While heart causes of chest pain are very rare, unfortunately they can happen, and some description of the story can be more concerning for heart causes of chest pain than others. For instance, chest pain that happens and then the child passes out is quite concerning. If that happens, please tell your pediatrician. Additionally, if a child's having chest pain that only happens during very strenuous activity, and it only gets better if they stop playing, and it's so bad that it forces them to quit playing and quit that sport, that's concerning. There are other kind of story aspects that can be both with heart causes and non-heart causes. For instance, chest pain that happens with fevers or happens with illness sometimes can be a sign of heart cause, but sometimes not. Also, chest pain that's just really severe and the child has to stop being active, stop playing, can be concerning. And lastly, and this is quite important, any child who's having chest pain with a family history, multiple people in the family with heart conditions at young ages, heart problems in their childhood, 20s or 30s, that's also quite concerning, and they should let their pediatrician or medical professional know.